Good afternoon. Good afternoon, good afternoon, good afternoon, White Plains. Good afternoon, everybody. Thank you for taking time out of your Monday today, or maybe you're watching this at another time that's more convenient for you. But thanks for taking time out of the day today. We have an update for you as well as questions and answers. But first, as always, I just want to thank everybody for taking the time to not only to tune in, but also for your continued ongoing support of the school district and most importantly, our kiddos, as well as our faculty and staff members and administrators. It is hard to believe that it is November 22nd, Thanksgiving week, but here we are. And I wanted to take this opportunity today to give you a pretty detailed update, hopefully on a number of topics that may be of interest to you. Some current event type topics, but also, of course, as always, taking time to answer your questions and hear from you in terms of your comments and your concerns as well. I want to start out, considering that it's Thanksgiving week, I want to start out personally with thanking all of you and offering my gratitude for everything that you've done over the course of the last 2 years. Really, it's unbelievable that now we're almost approaching 2 years. But the last 2 years, keeping our district in a very solid and strong position, keeping our kids safe, our community safe. Just thanks. I really feel very, very fortunate. I believe I'm very fortunate and blessed to have so many around me who, and you know who you are. Some of you just reach out on a random day just to say thank you, and I really appreciate that. I know our Board of Education is extraordinarily appreciative to every step of the way. They have been with us. I know some folks who say, well, hey, does the Board of Education? The Board of Education knows everything that I know. The moment I know it, almost. So thanks to all of our board members, thanks to all of our support staff members. It has been truly a team effort. And it is a week to be thankful and to be reflective and grateful, and I am absolutely that. It's also the Sunday will be the first night of Hanukkah. So for all of our family members out there who are going to be celebrating this year the Festival of Lights, we wish you a very happy and healthy holiday as well. All right, let's get right into our update today. Big on the horizon questions related to masking students in schools. Been a number of articles that have been out in the journal news. I know many of you have been following related to masking in the public school setting in the state of New York and what that will look like in the future. Well, you may have seen that the Lower Hudson Council of School Superintendents has been asking, along with our local legislators, has been asking the governor, but really the Department of Health at the state level, for guidance related to masks in schools, and particularly what are the data points, or is there a data point by which we are measuring when and if masking would potentially become optional. This is not to say that the school district, particularly the White Plains City School District or any school district, is advocating for masking to go away or to stay forever or anything in between. We are simply asking for information. It's been a number of weeks, really almost months, since we've received an update from the New York State Department of Health, and we recognize that there are a lot of moving parts, right? During that time, vaccination rates for our adult population has soared in Westchester County. We've had the advent of the pediatric vaccination available for children 5 years to 11 years. That's rolled out in the last couple of weeks. We also know that as we enter into the typical cold and flu season of the winter months, that those numbers associated with COVID-19 will likely climb. So we know that there are all these different factors out there and that the Department of Health has a lot to contend with, but we would like to be able to provide our communities with at least an update related to masking in public schools. Now, as it is right now, we are still all required to be wearing masks when we are in public schools. Of course, I'm in the office right here. There's nobody else here, so I don't have a mask on. But when we're out in the facilities or on transportation, we are all wearing our masks, and that continues to be an important prophylactic and sort of mitigating factor to help potentially stem the spread of illness. So that's what we're waiting to hear from the New York State Department of Health. As soon as we hear updated guidance, we will share that with our community, and be sure to keep you informed every step of the way. The other aspect that we are looking at right now is a so-called test and stay program. Some of you may have or may be familiar with this. There's a similar type of a program running in Massachusetts right now. And essentially, there's a lot of complicated information related to the program, but essentially it boils down to this. If you are a contact of somebody who has been identified to be COVID-19 positive, you could then still be in school or at work if you participate in a daily screening testing protocol. We have not, I should say this again, we have not moved into that in the White Plains City School District. We are still looking at that program, what the feasibility is, and also whether or not it even makes sense for our school district. So many of you recognize we've been very fortunate. While we have seen COVID-19 cases in the White Plains City School District, they have been markedly lower than we experienced this same time last year. We also know that cases of COVID-19 are on the rise in Westchester County. I think we're up to about 1,700 active cases in the county, as shared with us this morning at our morning meeting with County Executive Latimer and the team at the Westchester County Department of Health and Government offices. The numbers of folks who are being hospitalized for COVID-19 is thankfully very, very low. So that's good news. And, one can connect the incidence rate, even though it's rising, with the high level of vaccination that's taken place throughout our county. And that's all good. That's where we want to be. So even if, unfortunately, you contract COVID-19, you're not being hospitalized, you move through and you recover, and boom, you're back, just like if we had a cold or a flu situation. Nothing is going to change in the White Plains City School District, if it changes at all, until after the holiday season. We recognize and we remember last year that we saw incidence numbers of COVID-19 positivity coming to us in the school district increase. Of course, we predicted it likely would. Over the holidays, we're going to continue to monitor our COVID-19 cases and the health and wellness of our school community through the holiday season. So we will, of course, if any changes are on the horizon, we will then begin to explore them in January of 2022. So for anybody who's thinking about, what are things going to look like between Thanksgiving and the winter holidays, nothing is going to change in the White Plains City School District, absent a state mandate, which we do not believe is going to happen until, if it happens at all, until after the holiday season. Just makes sense. People are going to travel. We're going to be with family. There are all kinds of reasons to maintain where we are right now until after the seasonal push. So that's kind of where we are in terms of our thinking. Of course, any changes, potential changes, recommended changes, considered changes, all go through the White Plains City School District Reopening Committee. And of course, those recommendations are reviewed by our Board of Education. So we will continue to communicate with you as we move through the holiday season, and then when we come back out in the new year, if there are any changes, those will be communicated as well. We have had a lot of interest in the pediatric vaccine in the White Plains City School District. We are going to be running another cooperative vaccination opportunity this coming Saturday. I think that'll be our fourth one already for the initial shot. Remember, this is a two-phase, just like the adults. It's a two-shot inoculation protocol. We'll be offering another round of first vaccinations this Saturday at Post Road. More information will be coming out on that. So far, we have, I believe we're now approaching 500 students who have had their first shot from parents and guardians who wish their child to be vaccinated. I completely understand. We absolutely understand this is a very personal decision for parents and guardians to make in conjunction with their healthcare provider. The school district is simply providing opportunity with our community partners. We do not take a position. We are not healthcare providers. We always recommend that moms and dads and guardians reach out to their healthcare professionals to ask those medical related questions on what's best for their child medically. There's a question that's always lingering out there. Joe, do you think that there is going to be a mandate for the pediatric vaccine, the vaccine for ages 5 through 11? We have not heard anything about a mandate for pediatric vaccination. I have not even heard a whisper of that in the state of New York. Certainly, if we do hear of anything, we'll share that with parents and guardians. But as it is right now, this is a voluntary opportunity. We are, in fact, though, seeing a great deal of interest in the voluntary opportunity, and we'll continue to partner with organizations that can offer this to our students and parents and guardians who are willing and able to get their shots. So that'll be continuing, and we'll continue to share that information with you. I just want to also thank all of our nurses and our nurse aides, and of course Maggie Rasiopo, for all of the work that they're doing, liaising with our parents and guardians, with our students, with the county healthcare department, the healthcare department, the state healthcare department, our community partners. A lot of work going into the infrastructure of these opportunities for kids and for adults to get vaccinated and tested. So thank you very much to everybody. In terms of testing, our district continues to participate in the testing program. The testing program is always open. If you didn't sign up, if you didn't enroll to be part of that random screening testing that takes place, you can continue to do that, and you can sign up to be part of that program. Remember, it's 20% on any random day of students who are randomly selected to then participate in a saliva-based testing program. So it's very simple. It's not invasive. All of the information gets shared with parents and guardians. All of that is done directly through the laboratory and the home. Moms and dads get notified whether or not their children are found to be positive and or negative. It takes a couple days usually. It's a very busy time right now particularly, but it takes usually a couple days, and you get an email, lets you know if you're positive or you're negative, and also your school nurse is notified as well, so that we can support you at home if need be. The percentages of children who have been identified to have COVID-19 in our screen test process is very, very low. I don't even know that we've necessarily had more than 5. So it's a very low percentage, which is great. I mean, that just goes to show that everybody is doing their part or trying to do the best that they can to keep everyone in their households healthy. In terms of quarantining, isolation, and potential remote instruction, the good news to share with you is while we have had incidences where unfortunately we've had students who needed to quarantine or isolate for a period of time, they again are very, very minimal. We've had a few situations in terms of classes, and we've been able to work with parents and guardians to make sure that schoolwork and continuity of instruction continues. We're really happy that we're not seeing the types of disruptions that we saw last year. Again, a lot of hard work by a lot of folks, and of course, vaccination has helped in terms of adult vaccination. So good news there. All right, let's get into the questions. I don't have a ton of questions today, so I will tell you if you are interested. Let me just scroll down here a minute. I can look into the comments and do my best to answer as many questions that might be in the comments today as well. But I will start out with the questions that we received. And as usual, I will just read it and do my best to answer the question. If I don't have the answer, I will we will provide it to you. And again, if I miss something, you can feel free to reach out to me at any time. So first question is related to vaccine mandates. Many parents of K-5 students are starting to worry about vaccine mandates. Do you foresee COVID-19 vaccines being mandatory for younger children? I touched on that a little bit. I don't right now, but if we hear of anything at all, we'll share that with parents and guardians. Again, vaccination is a very personal decision, and this vaccine, as the adult vaccine, it's an emergency approved vaccine, so we understand that parents and guardians want to have a lot of conversations with their healthcare providers. We also understand that there are plenty of moms, dads, and guardians and kids who said, absolutely, I want this right now, and then everything in between. But we don't hear of anything related to a mandate at the moment. Next question is related to quarantine. If your children are both vaccinated, Okay, children are both vaccinated and someone in their class has been diagnosed with COVID. Do they have to quarantine? Will their sibling who attends a different school need to quarantine as well? Thank you very much for your question. So, fully vaccinated again is the 2-course protocol. I don't know that we have any children who are fully vaccinated, at least through the offerings that we've had so far. I know that that's not the case. When we have children who are fully vaccinated, I believe they would likely, and again, it hasn't happened yet, they would likely be in the same group as adults who have been fully vaccinated. And the impact of potential quarantine is far reduced. You need to be a really close direct contact to potentially be isolated or quarantined when you're fully vaccinated. So the question is, I'm unable to answer the question, I think, directly. I'm leaning toward probably no. But again, mitigating factors, it would be hard to know, how that contact took place. But likely with vaccination, that's another heavy-duty layer of protection, and quarantining will likely be few and far between. Another question related to quarantining. Can you please restate the quarantine policy for children exposed to COVID? What, if anything, has changed for those who are vaccinated? Thanks again. Again, vaccination is just taking place right now. Children are not yet fully vaccinated. You need to wait that period of time, and then have that full coverage, if you will. I do believe that you're going to see a similar type of protocol for fully vaccinated children in terms of potential exposure and whether or not they need to be quarantined or isolated. So the policy right now, as it stands, is drastically reduced from what it was. Masking in the classroom has helped to keep potential exposure way down. Those areas of potential exposure are really when children are unmasked in facilities where you could see a larger group of students be caught up in a contact trace. Right now, it's really direct contact, mask off closer than 6 feet for a period of time that's over 15 minutes. So we're not seeing a lot of that right now, fortunately. We also have the protocol, or rather the requirements are available on our reopening site, as well as the county Department of Health website, in case you just really wanted to drill into all the different machinations of how somebody could potentially be exposed and then required to quarantine. That again is done at the county level in conjunction with the school district, and all of those quarantines run through the county Department of Health as well. Thank you very much for your question. Next question is related. It's a threefer: COVID testing, quarantine, and holiday travel. I was surprised by how few students in my child's class received COVID testing kits. Are families still able to sign up for COVID testing? Yet, dependent upon the number of children in your class and then who was randomly selected, or who are participating and then who was randomly selected. Those are the children who receive the testing kits to take home and complete at home and then bring back to us. Families can still sign up for COVID testing. If students participate in COVID testing, negative results are sent in emails. If the results are positive, would a parent be notified first? I think the emails probably go at the same time to both the school and to the parents. Can you give an update on the plans in place if a student needs to quarantine? Yeah, right, same thing. If we need to put into place our continuity of instruction for children in classes that have been quarantined or isolated, we're prepared to be able to do that, as well as work with children who are well, not ill, but need to be quarantined for a period of time. The hope is that those are very, very few. Well, we're seeing it very, very few in numbers and compared to last year and certainly to our student population. Ahead of the holidays, please remind families of recommendations for unvaccinated or partially vaccinated people traveling. Yeah, sure, absolutely. So if you're traveling, please make sure that you're following all of the CDC recommendations. Keep yourself and your family safe and well. It's recommended that you get a test after returning from travel and staying home for 7 days, even if you're negative. Again, all these are recommendations. Remember, the emergency order is not in place in the state of New York any longer. And be safe. That's the most important thing. Be safe and keep yourself and your families safe. And this is actually, believe it or not, it's the last question. This question is related to masking. If the governor decides that after the holidays, students are no longer need to wear masks indoors, will the reopening committee or school district vote on that, or will it be based solely on the governor's recommendation? I'll likely be having my child wear a mask regardless. Thank you very much for your question. I think, let me take it this way. Depending upon how the governor would make a change would necessarily impact the way school districts receive that change. So what we have seen in the past is that when changes like that come from the Department of Health, sometimes they come sort of down to a county decision or individual school district decision. Regardless of how that plays out, I think, if it's not a mandate, we will consider how we can try to serve the greatest number of people in our community. That's what we've tried to do by sticking to the recommendations and requirements of healthcare professionals, and then trying to meet the needs of various people all throughout our community. It is likely that even when school districts have the option, let's say if they have the option to wear masks in school facilities or on transportation or not, we're going to have a lot of people who are going to continue to choose to wear masks. Probably as many people who are going to say, oh, good, I can take it off right away. And that's just fine. I think for a number of our families, if not all of our families, sort of the comfort level of making changes related to the pandemic is a very personal thing. And we're trying to, and we will continue to try to respect that. We don't want to force people in as much as we possibly can into one expectation or protocol or another. Everything that we've done to date has been a requirement. We have tried to increase where they're not required. We've tried to increase levels of mitigation to keep people safe and to also continue to provide a sense of security for all the members of our school community, understanding that everybody feels a little bit different. So the most important thing I think we can do is communicate to you as quickly as possible whenever there's a change or even a recommended change, and get you all the information therein. All right, that was all the questions for today, believe it or not. I will take a look into the chat to see if the comments, to see if there's anything else that I can ask. Hey, everybody, happy Thanksgiving. Thanks so much, everyone. All right, let's see, any questions? So temperature taking at the schools doesn't happen all the time with regularity. Thanks for your question, Kate. We're continuing to ask folks to self-screen, and our kiosks are available at every building. But yeah, not every child at every school every day is getting their temperature taken. Yep. And I think, oh wait, I'm sorry, more just came in. Sorry, everyone. You're seeing this in real time, by the way. If the entire class is vaccinated, will the mask requirement be lifted? Thank you so much for your question. Remember, the mask mandate is a mandate that comes from the state of New York Department of Health. It's not a school district mandate. It's not a school district decision at this time, but that's a great question. I think as we see more children being vaccinated, just like with adults, it will be likely that those types of mandates will change. Let's see if I can get any more here. Same question if kids are vaccinated. Question here from Paulette. Thanks for your question, Paulette. How are teachers doing? Well, from my perspective, our teachers and our support staff members and our administrators are doing everything they possibly can to try to make sure that our children are feeling like they're in a normal school year. They think they've done a great job. But you know what? To tell you the truth, just like everybody else in the world, teachers are people too, support staff and administrators. Believe it or not, even superintendents are people too. And, people have varying experiences. And just like everyone else at home, they've had struggles. We've, as a school district community and as a White Plains City School District community, have tried to be there and be supportive, provide supports and services for everyone in our school community, and we'll continue to do that. But I think that just the fact that you're asking that question is indicative to the type of care and community that we have here in White Plains, and I got to tell you, I really appreciate that, and I know our teachers do too. Thank you. I think that's it. All right, everyone, listen. From me, from my family, to you and your families, wish you a happy, healthy, enjoyable Thanksgiving. Hopefully you get a chance to take a little rest, Cyber Friday or Black, whatever it's called. Don't run around too much. Enjoy that time with your family, and look forward to seeing you after the holiday. And we'll have more. We'll continue to do our updates. We'll have reopening committee after we come back from Thanksgiving, and keep giving you all that information as soon as it comes to us. But again, stay safe, stay happy and healthy, and stay WP proud. Thanks, everyone. Take care.